global health studies. As well, I teach down at the medical school in the public health program, directing the global health concentration of the MPH. So the APHP has now existed for essentially a decade and has continued to grow. So we are currently looking to admit what will be our 10th cohort into the Accelerated Public Health Program. Can everybody see my slides? Great. So the APHP is a collaboration really across three major units across Global Health Studies program, the Masters of Public Health program down at Feinberg, and the graduate school. The curriculum, it basically allows you to complete your Masters of Public Health in a single year after completing your bachelor's degree. The MPH curriculum itself, the public health curriculum, is 16 total credits, 16 courses. And in addition to the courses themselves, there are two non-coursework requirements. There is the APEX, which is, you can really think of that as the practicum experience, where you're spending 100 hours working and engaging with a public health organization. And then as well, there's the culminating experience, which is a capstone project. You can kind of think of this as your master's. The nice part about the culminating experience project, though, is that the written portion, what can be submitted for the written portion of the CE, is more diverse than a typical master's paper. That yes, the written project for the culminating experience can be a standard research paper, but it can also be fulfilled in a number of other ways. You know, a policy brief, an op-ed piece. I've worked with students who've done culminating experience projects where they've developed a course syllabus as the final project. So it's a little more diverse and a little more flexible in that regard. Within the MPH, there are a number of different concentrations, areas of emphasis. So within the Masters of Public Health, there are some core requirements like, the general overview 301 course, behavior and society, as well as certain methodological courses like intro to epidemiology and intro to biostats that everybody takes. But as well, there are these 7 different degree concentrations, each of which have their own areas of specialization and own coursework associated with them. So these include the generalist, which overall is the most popular. The generalist has the greatest number of elective courses and the greatest flexibility. Community health research and evaluation, data science, epidemiology, global health, maternal child health, and starting this June in the summer will be a new concentration in implementation science, an area at Feinberg where in public health and medicine we are particularly strong. Implementation science is all about the process of taking basic research and transforming it into action, into policy recommendations and essentially implementation in terms of ways of improving clinical work or promoting public health outcomes. Of these concentrations, as I say, implement science is brand new this year. Maternal child health and data science are also relatively new concentrations. They were started a year ago. Just to give you a sense of the practicum experience, the APEX. This is something that in the one-year MPH program, which the APHP is sort of a part of, you jump right into in the summer, the first summer of your graduate training. So our director for the APEX, Adela Mizrahi, and her assistant work with you over your first summer to, decide on and find a site for doing your APEX experience. And currently, the public health program has a curated list of about 50 partner organizations in the Chicago area that students have worked with. The idea here is that, during the summer and into the early fall, you're working to identify a location that is going to work well for your interests in public health. And here are some examples of, some of the Chicago area opportunities for APEXs. The Cook County Department of Public Health. Pilot Light is an eyesight blindness organization and prevent blindness that students have worked with. Strengthening Chicago's Youth is a Chicago area youth mental health organization, the Illinois chapter of the American Academy of Pediatrics. They're also something that is distinctive with the APHP program is the ability to potentially do your APEX abroad. This requires taking some coursework during your senior year, but if you're doing the APEX abroad, this is always done during the winter quarter. And so through our Institute of Public Health, of Global Health, we have a number of different partner organizations that you can do your APEX abroad during the winter quarter. Going abroad in the winter quarter obviously necessitates your being able to opt out of other courses during the winter. Overall, the APEX requires 100 hours working with the partner organization. And then during the spring quarter, there is a poster session where everybody presents what they did for their APEX experience. All of the APEX hours need to be completed by the end of winter quarter of your MPH year. Typically, students who are doing APEXs locally, start in with their APEX hours during the fall quarter, and they often spill over into the winter. Whereas obviously, if you're doing your APEX abroad, all of the APEX hours are logged in during the winter. Culminating experience, this sort of just gives you an example of, some of the products that have been produced for the culminating experience. Policy analysis of abstinence-only sex education programs, looking at health and immigrant populations, Filipino-American community needs assessment in Skokie, a more standard research paper, a systematic review of after-school obesity prevention and intervention programs. And the final one here is an example of an APEX or a culminating experience project that was done with an international experience during the winter quarter. The other thing that I would note about the culminating experience paper is there are also opportunities to do primary data analysis and write-up of research. So some of you indicated interests in epidemiology. We have a number of students interested in epidemiology projects that are working with curated data sets that we have here at Northwestern down at Feinberg to look at questions of sort of, disease spread and epidemiological issues, both locally and throughout the United States. So that's another option that is possible. Professor Joe Feinglass every year works very closely with students who are working with some of these curated data sets. So what are the distinctive features of the APHP and some of the features that we were really mindful of when we created this program now a decade ago? Well, first and foremost, it allows you sort of early acceptance into the Northwestern MPH program. So by the end of your junior year that you're in and you'll be able to take part in and be part of the graduate program in public health here at Northwestern. Also distinctive, unlike many other Masters of Public Health programs, it gives you the ability to complete your MPH degree in a single year rather than what is more typical a two-year program, which has, of course, implications for tuition. Those of you who are global health students, majors or minors, or who have taken global health classes, you are allowed to count up to 300 level undergraduate GHS courses towards the MPH. Now, your ability to use all three may partly be dependent on which concentration you choose, but certainly with the generalists and the global health concentrations, applying all three of those 300 level credits is very straightforward. The other nice element of the APHP is you are actually in the program as of your senior year. So the program allows you then, if you have the space and the bandwidth, to take up to 4 graduate level public health classes during your senior year. So this involves going down to the Feinberg campus and taking selected classes with other graduate students in the MPH program during your senior year. As you can sort of see, what this means then is that it is possible to start your graduate year, your +1 year, having already achieved 7 courses towards the 16-course curriculum, reducing the overall courses that you would need to take during your graduate year down to as few as 9. And so this, for many students then, has led to being able to be off 1 quarter and reducing the overall tuition costs for the MPH program. The other thing that is a signature piece of this program is the advising. So you have specialized advising starting during your senior year. So those seniors in the APHP, meet with me at least once a quarter. We also have special events down on the Feinberg campus where you get a chance to meet with faculty and other students in the program. And that advising continues into your +1 year. So I remain your APHP advisor during your MPH year. And in addition, you have an advisor associated with your individual concentration during the graduate year, during the MPH year. Other thing that I've highlighted is, unlike other students who are applying from the outside into the 1-year MPH program, APHP students, by virtue of being able to take courses in your senior year, have the ability to be away during the winter quarter, potentially doing an APEX abroad. And this is particularly the case for generalist and global health concentrators. This is outlined on the website, what we look for in this sort of eligibility for the APHP. The APHP is open to any Northwestern undergraduate from any school. You apply during your junior year. We like to see an overall GPA of 3.5 and above, but this is not a hard threshold. So if your overall grade point average is a little lower, we still encourage you to apply. We evaluate applications from a holistic perspective, looking not just at your grades, but also at letters of recommendation, your experiences, and what your interests are in public health. And then prerequisite courses that we like to see that you have taken before you start the MPH program is a course in some aspect of human biology and a course in math or statistics. All of the classes that can fulfill these requirements are posted on the Global Health Studies website. I should point out that these are not the same as the sort of pre-medical requirements. So there's a much broader list of courses that can fulfill these two requirements. It's basically, we want to make sure you have some familiarity with basic human biology and some mathematics or statistics background, in as much as core requirements of the MPH have some quantitative methods, the epidemiology and the biostatistics. So you apply during your junior year. Senior year, you may take up to 4 courses towards the MPH. I should point out, though, that it is not a requirement to take graduate public health courses during your senior year. If you don't have the bandwidth, that's fine. And so a number of APHP students over the years, have started their MPH and have taken the full 16 credits during their +1 year, during their graduate year. And again, the individual advising that occurs. The MPH year, then you're graduating with your undergraduate degree and then really immediately matriculating into the MPH program. And then you're going to graduate with your MPH degree a year later. It does make for a very quick turnaround. So for this year's seniors who are in the program, we have Weinberg graduation on that Saturday. The big convocation is on Sunday, and then orientation for the MPH program occurs the following Wednesday. So it's a very quick turnaround. The other thing, though, that I've said to the seniors is, in many respects, having been here as a student at Northwestern already, you can provide a lot of help and orientation to many of the one-year students who are coming in from the outside. So the timetable. The application portal for the Accelerated Public Health Program is now open in CollegeNet. April 1st is the deadline for applications. We quickly then review the applications and reach out to the top applicants for in-person interviews that happen late in April. Typically, these happen the last week of April. After the in-person interviews down on the Feinberg campus, we make our admissions decisions. Those are announced by May 1st. And then we ask those students who have been offered admission to let us know whether or not they're accepting their offers by June the 1st. You formally start into the program, in the fall, basically, of your senior year. June of 2027 is when you would formally matriculate into the graduate program, into the Masters of Public Health program. And then the following June, graduating, June of 2028, graduating with your MPH degree. So some pointers and tips for the application process. Again, April 1st is the deadline. The application materials that are required is sort of standard application form from the graduate school, a personal statement, 2 letters of recommendation, one of which we like to see is an academic recommendation, transcript, and a resume or a curriculum vitae. After we do this initial review, then when we receive the applications, in-person interviews are scheduled then for on campus, down on the Feinberg campus in late April. What we look for in the personal statement is it doesn't need to be lengthy, so 1 to 2 pages. And what we like to see is having our candidates articulate their goals related to public health, what your interests are, as you were introducing yourselves. All 3 of you did a really nice job of sort of articulating where your interests in public health lie. So your statement then should reflect an understanding of public health. And we also like to see that statements reflect some familiarity with the interests and strengths of our public health program here at Northwestern down on Feinberg campus. Again, 2 letters of recommendation. The letter should be able to speak to the candidate's ability to succeed in a rigorous, fast-paced program. And that should, all of you have been our undergraduates here at Northwestern. So we recognize that being able to succeed in rigorous, fast-paced programs is something that you have a fair amount of experience with. Also highlighting specific traits and strengths that might be helpful in succeeding in this accelerated public health program. The in-person interviews, as I say, typically the last week in April. These are 30 minutes long, meeting with faculty members in the APHP. Down on the Feinberg campus, this is an opportunity, for candidates to outline their goals, tell us about their preparation for graduate public health training. We also set aside 10 minutes or so at the end of the discussion for all of you to ask us questions about the program. So it's a nice opportunity to really sort of come down to the Feinberg campus, get a little bit of a feel for the public health space down on the Chicago campus, and meet with some of the Feinberg faculty. That's the APHP in a nutshell. Really appreciate your coming out today and your interest in the program. If you have any additional questions, please, of course, feel free to reach out to me. These slides will be posted on the Global Health Studies website. And with that, I'm happy to take any questions.
I actually had one quick question
Sure.
about the degree concentrations.
Mm-hmm.
You might have said this, so I apologize. But when you're in the program, are you just picking one of those concentrations, or could you pick like 2? I think you said it was maybe 2. I just want to make sure I wrote it down right.
You can only pick a single concentration. And so
Okay.
one of the things that I'll be doing with the current seniors in the beginning of spring quarter is meeting with each of them and getting their concentration declarations. And so
Okay.
by May 1st of your senior year, you need to let us know which concentration you're going to focus on.
Okay.
Now, the issue that you're alluding to is one that comes up frequently as a question. Now, I've kind of got interests in a couple of the different concentrations. That often is a good recommendation for the generalist track, because the generalist then allows you really to sort of create your own adventure, and with the free electives to pick and choose, courses perhaps in the epidemiology or in the, community health concentrations. So you ultimately need to pick one. The generalist is the one that I typically recommend if you're sort of torn between a couple of different concentrations.
Thank you so much.
Yeah,
If
Skylar.
we're torn between 2 concentrations, would it be better for us to go with one that aligns more with our current undergraduate studying? Or could we shift to, like from global health to epidemiology?
Shifting from global health to epidemiology is a transition that we've seen a number of times. I think it really depends on your interests and some of what you're expecting to get out of the APHP and out of the public health training. I will say we have a very strong group of epidemiologists. The epidemiologist track, though, is a track that has a lot of requirements, very few free electives. So in terms of thinking about, say, doing your apex outside of Chicago, that's not something that is going to be doable in the context of the epidemiology concentration.
Okay.
And so
And
what
just
we've seen is that some students, are very interested in continuing the work that they've done as an undergraduate. So, in many cases, this has led, their undergraduate global health studies. They do the global health studies concentration. We've also had a number of students who have gone on Sarah Rodriguez's um, London program, have worked with her directly, and this has motivated them to pursue the maternal child health concentration. So some students really want to sort of expand and build on what they've done during their undergraduate careers. Others want to perhaps flesh out and go in a slightly different direction and expand out in different ways. And so it really depends on where your interests lie and what your core passions are.
okay. And just to confirm that study abroad, if you're doing the generalist or global health concentration, it's senior year, winter?
The No, the apex that you're doing abroad is done during your +1 year,
Okay, okay.
but it necessitates the sort of in the weeds requirement that has to be done during your senior year is winter of senior year. You need to take Public Health 306, which is the one required course for everybody during for the MPH. So if you have that knocked out and you're a generalist or a global health concentrator and can arrange your schedule so that you're free during the winter of your graduate year, then you can spend your apex abroad during the winter quarter.
Okay. Thank you.
Mhm.
Like a personal question for me, because a lot of the for the 300 level classes that we're allowed to take in undergrad, a lot of the anthro ones are cross-listed into global health. So how would that work with transferring over? So the one I'm thinking about is like Dr. Young's like water and security class. It was in both anthro and global health. So like yeah, how would that?
Um, and did you sign up for the anthro or the global health version?
Okay, so it depends on what you signed up for then. Because
It
I took it
does.
as
I mean, well,
anthro.
it does
Okay.
logistically, but that is Professor Young's course is one of the recognized 300 level classes that can count. And so even if you took it under the Anthro banner, it would still be eligible for counting towards the MBA
Mm.
degree.
Okay, that makes sense.
Let me just hold on for 1 second. Ba, 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 ba. And so this is just to sort of give you a sense of, one of the things that is available, made available to everybody when you start your MPH year is for each of the concentrations, there is a spreadsheet that lists out all of the courses that can be used that are required and can be used to fulfill, various requirements over the course of the MPH year. So here I'm just showing you an example of a typical completed MPH plan of study. This is actually for a part-time student who is spreading her global health concentration out over 2 years. But sort of gives you a feel of how courses are sort of pulled together over the course of the time that you're in the MPH. Just So to give you is everybody seeing this? And I'm happy to pass along this link after we're done, but this just sort of gives you very concrete sort of sense of what the degree requirements look like for the individual tracks. Everybody is required to, complete at least 16 total credits. Here is the generalist track. So again, core required course, everybody's taking behavior, society, and health. Intro to biostatistics, there's two separate flavors of that, either as public health or biostats. Intro to epidemiology. The public health 306 class is the one core requirement that is only taught during the winter quarter. And so this gets back to my point of if you are thinking of being away to do your apex during the winter quarter of the MPH year, it's the 306 class that you need to take during the winter of your senior year in order to free up your schedule. So that's health literacy and communication. The applied practice experience 1 and 2, these are basically, they're not real classes. They're kind of placeholder classes. Everybody then takes this class and the culminating experience class during the spring of the year that they're finishing up in order to basically present the final products for the apex and the culminating experience. The apex, being a poster, and the culminating experience being a written product. So as we can see with the generalist track, a lot of free electives to sort of pick and choose as you might. Community health research, in contrast, has relatively fewer electives. Data science, similarly, has relatively fewer electives, as does the epidemiology concentration. Here is the global health concentration, as you can see. I mean, here are some of the 300 level, then undergraduate global health classes that can be used as either electives or selectives for the global health concentration. And then the relatively new maternal child health concentration. And so I can send this along to all of you so that you've got the ability to sort of check out what's going on.
I had another super quick question, just about the application process, the letters of recommendation. You say that one of the letters should be from like a professor, someone academic, like that I've learned from.
Yes.
But does that second one, do you have any like specification for what that should come from, or do you guys not really worry about that as much?
We don't worry about that as much. So, I mean, both letters can be from professors, or one from a professor that you've had in class, another from perhaps a lab that you're working in. That second letter could also be if you've done shadowing as part of your preparation for thinking about applying to medical school. That's those are great letters to have as well. I think the overall recommendation with the letters is that they be able to sort of speak with some degree of specificity about the work that you've done, the experiences that you've had, perhaps related to public health.
Thank you.
Sure. Other questions? All right. If not, why don't we wrap it there for today? As I say,